Good morning, everyone. Thank you for joining us. Welcome back. I'm Steve.
And I'm Scott.
Together, we're Backyard Musings, the Science and Technology channel.
And we are talking about an interesting science, I guess you could say. This is a science topic, so um, hold on to it. We're gonna talk about it. This is gonna be good.
Yeah. Due to budget cuts, today's segment is brought to you by Chicken Out. If you're out of chicken, don't scream and shout. Tap your digits and call Chicken Out. I don't even know how that works. All right, here we go. A groundbreaking study introduces new non invasive screening tools that have the potential to greatly enhance patient comfort and clinical outcomes. Researchers have found that examining certain patterns of cell free DNA fragments in urine can accurately identify and assess the stage of bladder cancer. This method provides a promising alternative to invasive procedures like cystoscopies. Would you like to know more?
According to a new study in the Journal of Molecular Diagnostics, published on September 26th of this year by Elsevier, is that Elsevier? Uh,
Elsevier. Yeah.
Elsevier. Oh, we're going to get French. Okay. All right. This type of testing may lessen the need for repeated cytoscopies. Is that what?
I pronounced it wrong. Cystoscopies.
Cystoscopies. Okay.
Yeah.
Reduce medical costs and improve overall comfort and care for patients. Bladder cancer, which we talked about some of these kind of cancers a couple of days ago, and
Yeah.
this is a bad one. Bladder cancer continues to be difficult to manage because it's both common and highly prone to returning after treatment. Despite these challenges, diagnosis still depends largely on invasive and expensive techniques such as cystoscopy, inserting a thin tube-like instrument through the
Oh,
urethra, cytology, a non-invasive test that detects tumor cells shed into urine is also used, but its sensitivity is limited. I'll
yeah.
bet.
So I'll just tell a quick anecdote before I go on. I was a young man before I got baptized. Okay, so this is before my army buddies played a joke on me. I just got into Fort Bliss, so you remember I wasn't baptized yet, and they were telling me, "Hey, Steve, you hooked up with that girl, so it was questionable. You better go get checked out." So of course, me being naive, I went to the troop medical clinic to go get checked out, and they took like a long Q-tip, metal one with Q-tip at the end, and they put it up the urethra, and man, that thing hurt. Pain. Look, I can see you grimacing with pain right there. Yeah, it hurt, and they punked me, and I fell for it.
So up your hoo-hoo.
Yeah, it
Oh
hurt
man.
bad, man. So the test came out negative, of course, but they were just trying to punk me. To explore a more patient friendly option, the research team examined urine from 156 individuals with bladder cancer and 79 matched controls. Using real time PCR, they evaluated both the amount and the integrity, long short size distribution of the cfDNA fragments from 5 genes. And here are the acronyms for the genes: ACTB, AR, MYC, BCAS1, and STOX1.
Man, I'm still trying to get over this metal rod with a Q-tip at the end of it.
Man, it hurt,
So did
man.
you do anything to those guys?
What could I do? Punch him? No. I mean,
Oh
they
man,
punked
I
me.
I would have put something in their cereal or
It was
something.
an
But
intense burning sensation, man.
yeah, the groundbreaking research shows that analysis of specific patterns of cell-free DNA fragmentation in a simple urine sample can effectively diagnose and stage bladder cancer. Is that stage or stage? Stage bladder
Yeah.
cancer. This approach offers a much needed alternative to invasive procedures like cystoscopies, lowers healthcare costs, and improves patient comfort and outcomes.
Yeah, I'll say. Quote, our most significant finding was that the small fragment of the MYC gene may represent a valuable tool to diagnose bladder cancer as it exhibited excellent specificities, 97%, and predictive value 88% for identifying muscle invasive bladder cancer, explains investigator Pilar Medina, PhD, hemostasis, thrombosis, arteriosclerosis, and vascular biology research group, Health Research Institute Hospital La Fe, Valencia, Spain. That's a pedigree right there. MYC produces a transcription factor crucial for regulating cell growth, proliferation, and metabolism.
Additionally, researchers found that the ratio of large to small fragments of the housekeeping gene ACTB and the small fragment of the AR gene increased with disease severity, suggesting that these could be reliable staging biomarkers. The integrity of these genes may be useful to identify bladder cancer relapse.
That makes sense. That makes total sense. Lead author Raquel Herranz, MS, hemostasis, thrombosis, arteriosclerosis, and vascular biology research group, Health Research Institute Hospital La Fe, Valencia, Spain, notes, quote, with growing interest in liquid biopsies and personalized medicine, our study offers a timely and practical alternative to invasive diagnostics. The study is one of the first to comprehensively evaluate urine of cfDNA fragmentation and integrity across most bladder cancer stages, bringing us closer to a future in which bladder cancer can be diagnosed and monitored through a simple urine test, improving patient comfort and care. End quote. That's the propaganda there.
Dr. Medina concludes, quote, our findings show that urine can tell us much more than we thought. It holds the potential to transform how we detect and manage bladder cancer, unquote. So that's a good deal.
The progress. I like the progress.
Yeah, we do. I'm sensing this. I'm feeling that they're going to come up with something very soon, within the
right
next
on the cusp. Years. Yeah, right on the cusp.
Yeah, because they're making a hard charge on some of this stuff, and we've talked a lot about it over the last year. So
all the different types of cancers that they're testing out and finding and preventing.
Yeah.
All right, folks. Thanks for joining us. We'll catch you in the afternoon.
Take care. See you this afternoon. Thanks.